you don't want to get implants. You can do a lot of exercise, but that's not really working. There is something you can do, though. Noted cosmetic surgeon Dr. David Broadway is here with this fantastic new procedure called VASER, and we have some pictures to show how it works as well. But this is really neat, that because I know a lot of women probably just do not want to go under the knife.
Well, that's true sometimes, and what we learned from doing liposuction in the chest area and in the axilla in women is the women were happy with the liposuction results, but what they were really excited about was the appearance of their breasts, and they appeared to be larger, even though we weren't putting an implant in there.
Okay, so what are we looking at right here?
This is actually a patient that had VASER breast lift, and with virtually no scarring, I was able to lift the breast up and give a nicer appearance. With the blackout that you have there, it's hard to see the transition that she has, but she had a dramatic improvement with virtually no scarring, and this was using VASER technology, just a little bit of liposuction, and she got a virtually scarless breast lift.
That's really fantastic, because I saw these pictures before we had to black them out back in the newsroom, and you really can tell there's such a big difference. And her skin seemed a lot tighter too, almost as if it was, I don't want to, well, shrink wrap is a word that I've heard before in association with this, but you know, not painful like that. Right?
Well, it actually does sort of shrink wrap the skin. It tightens the skin up, and it brings the skin envelope tighter so it can lift the breast up.
Okay, all right. So now, who's a good candidate for this?
Well, this is for a patient that has mild to moderate breast ptosis or droopiness. It's not for women that have very heavy breasts. It just is not powerful enough for them. So a more traditional breast lift would be more appropriate for someone like that. Okay.
So the major components of this basically happen to be manipulating the breast tissue, and we have some tips to put on the screen for you right there if we could get those up. Defines the breast shape, as you were saying, and contracting the skin. I guess that all works together, and it actually raises the proportion, especially from the side.
It can, yes, ma'am.
Okay. So if you want to combine this with implants, can you do it?
We do that all the time, and actually it's the most common opportunity for us to enhance the breast. We can use implants because they do have a role. We use liposuction to enhance the contour between the breast and the axilla, to take away the extra tissue at the top that a lot of women complain about, that bra excess.
Oh, yeah.
And then we use the implant to give a bit more superior fullness. So all of these techniques are combined together.
So that's what we're looking at right there, and there is a major difference.
Yeah.
So I would imagine if you just did the implants and didn't do the other procedure, would the implants look less natural, would you say? Or
I think where you see the real improvement with the VASER lift and the lipo is the positioning of the breast tissue, bringing the nipple up higher, and also you can see a definite contrast between the lateral or the side of the breast and the axilla, and also we're trying to highlight the pectoralis muscle as well.
Beautiful work, Dr. Broadway. Thank you so much for coming on.
Thank you for having me.
And I know you'll be coming back because you've got a lot of cutting-edge stuff going on over there.
I appreciate it.
Okay, it's great to see you again.
Thank you so much.
Dr. David Broadway. And if you